Good morning. I'm Chris Murray from the Institute for Health Metrics and Evaluation, and I'm very pleased to welcome you here to Seattle and to the Global Health Metrics and Evaluation Conference. We, in the opening comments here, will have representatives of the organizing committee making some reflections. I call your attention to the larger membership of the organizing committee that is a very prestigious group that's listed in your program. I do want to mention a sad note that one of the members of our organizing committee, Michael Foster, unfortunately passed away in May, and so we are sad to lose a colleague and somebody who was really quite an important figure in the evaluation field. Talking about the conference briefly, just a few statistics to give you a sense of who's been engaged in this process. We had 642 abstracts submitted to the conference, and we have selected, the organizing committee through scoring, selected some 150 or so for both oral presentation and poster presentation. So 3/4 of the abstracts didn't get selected, and I think that's a sign of the vibrance and health of this field. And I'm happy to say there's 540 participants from 49 countries registered for this conference. Now, in line with the idea of just letting the science speak for itself, we've done very little in structuring the agenda other than organizing the abstracts selected for oral presentation around certain themes. And in a few cases, because we thought setting context would be useful, but in a very limited number of cases, we've added invited speakers. But otherwise, the program represents the body of work as submitted for review and those that came out in that process of being selected for either the oral presentations or posters. So we will see a lot of young researchers in this conference because in many cases groups have put forward their younger members to present or stand by posters. And I think that's a great aspect of this conference and one that we hope to see new faces with new ideas and will hopefully stimulate further engagement in the future. I'm now going to pass over with those brief administrative and descriptive remarks to Julio Frank, who is both a member of the organizing committee, but also has been integrally related to framing the field around metrics and evaluation. Over to you, Julio.
Good morning to everyone. Indeed, I'm here, I think, wearing 3 hats as chair of the board of the Institute for Health Metrics and Evaluation, as dean of the Harvard School of Public Health, which is one of the co-conveners of the meeting, and as a member of the organizing committee. And I'm truly delighted to join Chris in welcoming all of you to this very exciting conference. IHME is now culminating 6 full years of existence. And I think we can say that it's been a remarkable example of institutional development that has greatly enriched the very pluralistic landscape of global health. And it's come exactly at a time in this golden era of global health where we need the illumination provided by sound metrics and evaluation to make sense of this complex and increasingly interdependent world. And from the very outset of this period of time, it was very clear that the field of health metrics and evaluation had to be built on 4 pillars. First, of course, a very clear conceptual base. But in addition to having conceptual clarity about the limits and the content of the field, I think it's very important to develop the structure and processes for the production of knowledge, the reproduction of knowledge, and the utilization of knowledge. Now, the production of knowledge has exploded. I think the statistics that Chris just shared about the number of abstracts submitted is just an example, and practically all of you in this room and everyone attending this conference are now part of this vibrant base where we are generating increasingly powerful and valid evidence around the fundamental issues in health. In the case of the IHME, of course, there's been an impressive record where this conference comes exactly following the release of the Global Burden of Disease 2010, of which we will be hearing a lot. I like to think of the GBD as the sort of equivalent of the Human Genome Project in global health. I mean, just because of the scale and the magnitude and the amount of data, I mean, it has now placed global health firmly in the realm of big data. So we're out there now with imaging and genomics and all the growing fields, and of course cosmology and particle physics, all of these big fields of big data. But it is not enough, impressive as the progress in the production of knowledge is, it is not enough just to produce knowledge. We need to reproduce it, to recreate it. And there's two very important vehicles to do that. The first one is, of course, through publications, and I think the partnership with the Lancet, the rigor that the Lancet brings through its peer review process, and this partnership between the Institute and the leading publication in our field, I think has again generated an enormous scope for reproducing the knowledge. The other major instrument for knowledge reproduction is exactly conferences like the one we're having now. In addition to the conference where the Institute was launched, this is now the second Global Health Metrics and Evaluation Conference, and just the numbers have just been building up. And I think we can say that this conference has played an enormously valuable role in building a global and pluralistic community around health metrics and evaluation. I think this is now a reality. Finally, any field has also to worry about the utilization of knowledge, and I think the fact that important policymakers are attending this conference speaks about the progress we've made in that fourth pillar. So a good conceptual base, a great base now, an expanding base for the production of knowledge, vigorous reproduction through publications and this tradition now of the global health metrics and evaluation, and again, vigorous utilization of knowledge. I think we can say that the field is really taking shape in a very, very impressive way. This edition of the conference now comes at a crucial moment of transition as we seek to define the shape of the global development agenda after 2015, the last plenary session. In fact, we'll talk about this. But what is clear to me is that health metrics and evaluation have a crucial role to play in illuminating the path forward. And I hope that with that charge, we will all have a great conference. Thank you very much, and I look forward to all the very exciting presentations in the next 3 days.
Good morning, everyone. I'm Fatima Marino from the Pan American Health Organization, that is the regional office of WHO. It's my third conference in Seattle discussing global health metrics and evaluation. And this year, I would like to point that this year we added to the conference the vital statistics strengthening. And for me, it's very special. This concern is part of the debate. It's because we are bringing together theory and practices. We see this present meet as a part of the commitment of all we present here in the conference, our hosters, IHME, the Lancet, the London School of Hygiene and Tropical Medicine, the University of Melbourne, and the countries present here. For the first time, as pointed Chris, we have much more countries taking part in the conference. I believe it's part of this commitment that is transforming and translating theory in practice. So innovation and debate of new metrics, but also innovation and debate of the practice that we are doing to improve the information in the whole world, but improve information to improve health. That's our main concern. So we are not just discussing innovative methodologies. We are not just discussing our metrics and good metrics for our analysis and publications, but we are implementing efforts to improve the information and to improve the health in the populations. That's our main concern, and bring together experts, professionals, academics, countries, and discuss the progress and challenge towards the improved the population health is our goal, it's our common aim. The information is a critical component of the health systems. I believe the information is the main problem of the Millennium Development Goal, because we have made a lot of efforts to improve this information, but we still have problems. We still have countries without information system. We still have a lack of quality in our information that we are discussing. So discuss metrics and discuss innovation. It's important for us to, as pointed Julio, that to guide us for a better use of the information that we have right now. But at the same time, it's important for us that work with the countries and work in the countries to translate these innovative methodologies to our practices. That's my main message for this opening, the conference, because the populations living in vulnerability conditions are those with less information available. So if you look at the average of the country information, I believe in the next following roundtable we will discuss this. So if we look at our country average, we don't look at the most vulnerable population. So we have to focus more and more and improve our practice and improve our decisions to make better the population's health. That's our commitment in the organization, the Pan American organization, and that's why we are part of this process, working with IHME and the discussion and the implementation of new methodologies. And we congratulate the hosters, especially Chris, for these innovative methods that bring together all of us and put us for 3 days discussing, debating, and giving directions. Giving direction, that means a better way to do our work and a better way to make our commitment reality, because we have to transform this world. So we have populations living in very poor conditions without any information to guide and give direction to a better policy. So this debate, I believe that theory and practice come together here now, and I hope that at the end we have much better direction to us to do better our work and transform this world in a better world for living. Thank you.
Good morning. In Morton Jervin's superb book, Poor Numbers, How We Are Misled by African Development Statistics and What to Do About It, he writes the following: how good are these numbers? The short answer is that the numbers are poor. This is not just a matter of technical accuracy. The arbitrariness of the quantification process produces observations with very large errors and levels of uncertainty. This numbers game has taken on a dangerously misleading air of accuracy, and the resulting numbers are used to make critical decisions that allocate scarce resources. International development actors are making judgments based on erroneous statistics. Governments are not able to make informed decisions because existing data are too weak or the data they need do not exist. Morten Jerven reminds us that the word statistics is, of course, connected to facts about the state. Indeed, statistics, in one view, is the science of the state. But he also points out that validity has its origins in ideas about power and force. The etymology of the word validity comes from the word force. In other words, numbers are, as we know, but perhaps don't discuss enough, political. It's why, he says in his book, institutions and the ones he quotes, but one could choose others, like the International Monetary Fund and the World Bank, are so concerned about maintaining the official validity, for which read power, of the numbers that they publish. And he concludes that the fact that there is no coherent global strategy for improving the provision of data for development is not a technical failure, it is a political failure. It is a fear of accountability, whether you are a donor, a corporation, an NGO, a government, or even a medical journal. These thoughts were in my mind last week as I was locked in a room in Geneva in WHO. The views were fantastic. Drafting the second report of a group that you would be entirely justified in never having heard of, the Independent Expert Review Group on Information and Accountability for Women's and Children's Health. What a ridiculous title. A very long title for a very small group of 8 of us who worked together each year until 2015 to try to say something interesting about progress on the UN Secretary General's Every Woman, Every Child initiative to accelerate action on women's and children's health, with a special eye on MDGs 4, 5, and 1C. We also have to assess progress on implementing recommendations from 2 commissions, the Commission on Information and Accountability for Women's and Children's Health, and a new one, the Commission on Life-Saving Commodities, which published its findings last year. Our task is to try and strengthen accountability. And our model of accountability comes directly from the human rights community, and it's in 3 parts. The first part is the collection of the most reliable data that we have to hand. The second part is its independent scrutiny and review. And the third part are to try and work out the actions that should be based upon those data and that review. But this is sometimes a very uncomfortable and confusing place to be, because we have the meeting of 2 traditions here, health metrics and human rights, 2 scholarly communities that are not the most obvious marriage made in heaven. 2 communities of lawyers and scientists with very different languages between one another and wildly different criteria for what stands for good evidence and not. Indeed, quite honestly, a mutual suspicion, sometimes bordering on paranoia about one another. But let me give you 3 brief reasons why the health metrics and the human rights communities must join hands, and why this conference is an opportunity to do so. First, let me return again to Morten Jerven's book, Poor Numbers. He argues against trying to see numbers as facts about the state. Better, he argues, to see numbers as products of a particular political, economic, and social moment or context. That way, we see numbers for what they truly are: instruments of power, control, and ownership, which is why the review part of our monitor, review, action, accountability model is so important, and of course why it's so resisted, because it demands the participation, and participation is a fundamental human right, the participation of civil society, the media and communities who are often excluded from all decision-making processes in countries. Second reason why the health metrics and human rights communities should come together: there are two additional important principles in human rights: equality and non-discrimination. And what these mean to us in the metrics community is surely an abiding commitment and concern to count and to measure the least advantaged and most marginalized groups in our society. And it is deeply meaningful to do so. When Anand Krishnan and his colleagues studied the benefits of economic development in rural northern India, yes, he found advances in health thanks to that development. But he also found economic development worsened gender equity. When Mats Malmquist studied maternal health in Vietnam, he found, yes, absolutely, increases in antenatal care attendance and increases in health facility deliveries. But he also found increased ethnic inequities in service use, leaving vulnerable populations excluded from what looks like an overall success story. When Kim Hwang Nguyen measured progress towards MDG 4 in Nepal, indeed he did find great reductions in under 5 mortality rates. But he also found inequalities that grew for some particularly vulnerable groups. The combined force of the health metrics and human rights communities encourages us to look for unintended adverse patterns of health that might be hidden by national averages. What the health metrics and the human rights communities can do together is to give special attention to these vulnerable, socially excluded, and marginalized populations. And that's the great contribution that you in the health metrics community, combined with those in the human rights communities, can together bring to global health. To make the uncounted counted, to make the invisible visible, and to give those without an opportunity to speak and shape their futures that opportunity. Let's do our best at this conference to achieve those goals. Thank you.